Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about some of my favorite exercises to give for people that are in throwing sports once they're in the later stages of their rehab process and we're really trying to, again, mimic, right, some of the actions that they have to do. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially, with the throwing action, right, the overhead movement here, what I like to do in terms of the rehab process is when we're nearing the end, and this goes for really any activity, we want to try our best to essentially mimic, right, what we need to do for that activity. So with the throwing, right, what I like to do is sort of break down the different muscles near the end that are required in terms of the throwing action. And so some of these exercises, right, again, will kind of mimic what we need to do. So the first one, I just have a TheraBand here. So I'll have the patient do some, it's called external rotation, right, with the band here. And so essentially what we're doing here is we're working on what's referred to as your infraspinatus muscle. So it's one of the rotator cuff muscles that's responsible for external rotation, right? So again, I'm going to work below 90 initially, making sure we're pain-free, squeezing those shoulder blades back and making sure I'm in good position. So that's typically step one. From there, right, what I'm going to do is do a little bit of, it's referred to as shoulder abduction. So shoulder abduction involves this movement, and the main muscle that it's targeting is called your supraspinatus muscle, which is a super important one for throwing. So again, it's going to be this motion out to the side, kind of at a 45-degree angle. I'm squeezing back, right? I've got my good posture here as I'm coming up and out to the side. Okay. From there, right, I'm going to do that external rotation actually at 90 degrees. So this activates supraspinatus and it activates the infraspinatus to some degree. So now it's sort of a combo of the two. So now I'm keeping my elbow above shoulder level and I'm going into external rotation right at that 90-degree mark. Okay, I'd also potentially do that the opposite way. So essentially tie the band up to maybe a doorknob, right, and go on internal rotation the opposite way. Okay, from there, the last phase I like to do is I'll tie the band to something and then actually have the patient, right, go into the throwing motion. So essentially breaking down all, like we broke down all the different movements first and then actually do and go through the exact throwing motion, right, with the band. Okay, so we're really moving from, again, targeting these, isolating the different muscles first, right, to further and further closer to that throwing action until we put it all together. And then again, along with that, we'll want to look from a biomechanical perspective that everything's appropriate, right? Like, so keeping the elbow above the shoulder, and that there's nothing that would be causing extra stress or strain through the shoulder. And again, this is really part of the last phases of the program for a thrower. So thanks again for watching. Please feel free to leave a comment below. And please make sure to check with a physiotherapist or a doctor to make sure this exercise is appropriate for you. Thanks again and have a great day. Take care.